Hi, my name is Dr. Kathleen Simeo from Hearing Solution Centers, and today we're going to be talking about tinnitus and COVID-19. Coming up. So far, we have found there's about 60 studies that have reported people with confirmed COVID-19 having some type of audio or vestibular system issues. And of those people, the American Academy of Audiology is showing that about 7 to 15% of those issues from people are reporting a number of things, but the primary one that they are reporting is tinnitus. There's a lot that we don't know about that yet, even what exactly is causing it. But today I'm here talking to Dr. Brooke Bernston, and we are talking to her because she has actually experienced this within the last year. So just kind of wanted to get an idea of what it means to her and how that's affected her life and kind of what we're trying to do about it. So Brooke, tell me a little bit about tinnitus and kind of where this started for you.
So I've always had tinnitus. It's normal even, with people who have no hearing loss or anything like that. And so I used to have it predominantly, it would occur in my left ear. And it would mainly happen when I was extremely stressed out. My ear would have the really high pitch ring. And sometimes it would just completely shut down. And then all I would hear was just this constant tone. And my left eye would twitch. And then, my stress would kind of go away and it would also go away. So it wasn't necessarily a big deal or anything that I worried about.
How often was that typical before?
It kind of varied. I mean, I wouldn't say it was necessarily every day or every week. It's just the more my stress increased, the more the tinnitus increased in my ear. And I can't really tell you when I first noticed that I had ringing in my ears. It may have been, I noticed it more once I got into this field. But other than that, it was just intermittent. Not constant, not always in both ears, but like I said, predominantly just my left ear. Okay. So, and then in January, I think it was end of January, is when I got COVID and got sick and everything like that, quarantined at home. And not long after that, and after doing my quarantine and coming back to work, that I noticed my tinnitus was in both ears. It was constant, and it was even higher pitch than what it had been prior to.
Okay, so it didn't seem like it was stress related anymore.
Right, because now it was just all day, every day. I would be sitting in my office, and if I didn't have music on, it's all I heard in both ears. So I turned music on to try and mask it. And that didn't always help, especially if I started to focus on it. If I started to focus on it, I felt like it made it worse. But even at home, if I was trying to read a book and I didn't have any noise going on in the background, I could not concentrate on just reading a book, which is something that's relaxing to me. And so I would stop reading just because I felt like if I was moving around or doing something, I didn't pay as much attention to it.
So that is actually something that a lot of people report, is that tinnitus is going to mess with their concentration. Mm-hmm. And it does become, as it becomes louder and you're focusing on it more, it almost seems to even make it worse. So it's kind of this vicious cycle. So kind of in relation to that vicious cycle, did it seem just kind of as time went, it just became harder and harder? Or did you feel like you were able to kind of deal with it a little bit better?
That's the tricky part, because, we have patients who come in and and they may not have it where it's constant. And we try to indicate, do your best to ignore it. And I'm telling myself to ignore it, but at the same time, I realize it's very difficult to try and do that. Especially at night, trying to go to sleep was really hard for me to do. My husband, he'd be passed out and snoring, and I'd just be there awake and trying all these different techniques to go to sleep. Eventually, what worked for me was we put a humidifier in the room, and so when you pour the water in it, it starts bubbling and making that sound. And so I'd go to like my happy place, and then I would just listen to the bubbling of the water, and that could usually put me to sleep where I didn't just focus on it. So yeah, I mean, some days were easier. It just depended on what I was doing. The more active I was, the less I noticed it. But if I'm, doing reports, if I'm reading, even, I mean, sometimes after working out, I would notice it'd be a lot louder, or just doing other things. It was constantly there. I tried not to focus on it, because if I focused on it, I'd get stuck on it. And then it was just trying to tune it out.
Yeah. I know for a lot of people, when they do go to their physicians or people and say, hey, I have this ringing in the ear, they're told, we can't do anything about that, just ignore it. And so it sounds like with you, just telling you to ignore it is almost, yeah, it's really downplaying the severity of it. And I'm sure for a lot of people, that's incredibly disappointing to hear that. Mm-hmm. So we've been trying in our office to look at some alternative options for people, not necessarily looking for a cure or anything like that, but at least something that can give some people some relief. Mm-hmm. So we actually had tried one of the things that we've done on you. So we actually work with some essential oils. We have one, it's called Quiet, and that's the one that we let you try. And the way that we work with this in our office is we have what's called a Tinnitus Handicap Index. It's an actual report that a lot of audiologists and ear, nose, and throat physicians will use to not measure the loudness of the tinnitus, but to measure the impact that the tinnitus has on a person. And so we rank that on a scale based off of a number of questions about how that's impacting. And so for you, when we initially tested you, I think, you scored a 48 on that, which put you at this moderate level. Mm-hmm. So we typically break people, there's about 3 or 5 different levels. That puts you at a level 3, which means that it was definitely impacting your life. Not as bad as some people, but certainly more than what most people feel like it is. And then we wanted to let you try those oils to kind of see how they worked out for you. So go ahead and explain to me how you applied those oils and when and all that fun stuff.
So I did the Tinnitus Handicap inventory. Got my results from that, and I think both you and Scott were kind of like, oh, yeah, like, this is not good.
Right.
And we did the testing in the booth, and I remembered finding the volume of how loud it was, but when you were trying to find the exact, pitch, I remember going like this, telling you, higher, it needs to go up higher, and you were like, I'm maxed out on the machine. I can't go higher. And so, we went to Google and attempted to put in frequencies, and we found that it was up at 15,800 hertz or something like that. And you even said, I can see why that's not comfortable.
It's almost painful.
Yeah. And I don't feel like I showed it here in the office or anything, but at home I felt like I definitely showed I was more irritable with it. So when I was given the oils, someone, I don't remember who, did the VitaFlex on me first. So the VitaFlex is The oils are in your hand, in the audiologist's hand, and they'll put your hand, rub it on your ears. And then there's different planes and orientations that we kind of put your head through. And so that was done first. I think it was just one of you guys just did it once. And then I was given the oils. And when I first started, I was doing it twice a day, sometimes 3 times a day. And I'd put a couple drops in my hands. And I'd go clockwise, I believe. And then I sometimes would just rub it on my ears, and then for 3 minutes, and I would usually set like my timer, I believe it's 3 minutes. And then I just breathe it in and breathe out. Now for me, I know when I first started with when the oils were first introduced, I could not stand the smell of it. And so it really bothered me, but everybody else really liked it. But going through this, I eventually really learned to like the smell of it. So that was good. But it's pretty strong, so I kind of kept my hands a little bit further away from my nose. And while my timer's going down, I was just sitting there and just doing calming things, breathing in, breathing out, just kind of doing that process. I typically did it in the mornings, right before coming into work, and then I did it every night before going to bed. And there was even a couple times in the middle of the night where I would wake up, and pretty much I would wake up because of the ringing in my ears, and I would go and grab the oils and I would do it all again. And I did it for about a month consistently, and I felt things had kind of calmed down a little bit in terms of just the shrillness of the tinnitus. So now I don't necessarily do it every day, and I don't do it necessarily twice a day. Some days I like to do it because I find the oils calming, and that helps just with my stress and anxiety anyways. And other days I feel like my tinnitus, it kind of just pops up, and so I'll do that again.
So after you had done it, I think we did a 30-day.
Yeah, we did 30 days.
We went ahead and we had you retake that Tinnitus Handicap Index to try to just see if we really did see any change. And we actually did. So the first time, remember I said you got like a 48, so you were at that moderate level. After that, we took it again. That time you scored a 26. So you went from 48 to 26, and that took you from the moderate level to the mild level.
Right.
So it's not gone completely.
Right, but it's definitely more manageable, I guess I can say. I'm not using the humidifier in my room anymore at night. I am able to go to sleep. So I'm not doing the oils at night. Typically I'll do them sometimes in the morning, just because I work out in the morning, and if I blow dry my hair, my ears will start to ring. So I do that to kind of help with it, and then I'm good.
Cool. Okay. So I think it's one of those things where we're trying to find in this office is maybe some alternatives for people. And it's really interesting how this kind of can affect everybody differently. We've had people in the office who said, yeah, my tinnitus just went away completely.
Yeah.
But more what we're seeing is people who their tinnitus is reducing. We've had other people whose tinnitus has changed pitches. So we had one gentleman, when he took it, his tinnitus was that very high pitched, almost like a squeal, like you described it. And then after he took these, the pitch moved to a much lower tone. And even though the volume stayed the same for him, because that tone had changed to a lower one, it was a little easier for him to just kind of mentally push it into the background. And then with a little bit more training from us from there, it was able to become much easier for him to deal with it. We had another one who kind of described it as like if you're painting a house and just like one layer of paint over another layer of paint over another layer of paint. He said it's like chipping away layers. So there's still paint there, but you're getting rid of all that overlying thing. So it can change and do a lot of different things, but I think it's really interesting because this is something that's giving people hope.
Well, and like, so my tinnitus is still at that very high pitch when I do have it. It hasn't dropped back down to where it was prior to COVID. And it's still in both ears. So, right, it hasn't reverted back to its old ways, but it's a life of its own. But like I said, yeah, it is definitely more manageable. It doesn't, I'm trying to think of the word. It doesn't freak me out as much as it did before, I guess. Not that it ever scared me. You know, I knew what it was. And I think that's also a big difference compared to some people is they don't know what it is. I'm very familiar with it. It's part of our field. But yeah, now it's, like I said, it's more manageable. Because I even at one point thought about going out to the hyperbaric chambers, which I know is one of the avenues that we have for patients. Mm-hmm. And I contemplated going out and doing that because it was not good.
Yeah. And I think that's going to be happening more as, you know, as we see more people with COVID starting to come, especially after, you know, they get past a lot of the severity, a lot of the more severe issues, and then that's going to be something that for a lot of people is going to continue to linger.
Right. And
they're going to start looking for answers. And so I know sometimes when you Google something, you get the, you know, little red flags and everything stops popping up. And, you know, kind of physicians, they'll always tell people don't Google anything because it can it can scare you.
Yeah.
So I'm hoping that with this information out there, this will be something that can kind of help people say, okay, well, maybe there are some options out here instead of just telling me to get over it.
Right. And again, the oils worked well for me. Again, prior to using them, I didn't quite know what I thought about them, but having used them, having seen a big improvement, you know, I know it worked for me. But right, they may not work for someone else, but we have other avenues that we can try.
Yeah, absolutely. Okay, well, thank you for talking to us about this today. I know it can be personal sometimes, but I really appreciate it. I think it's good to put a face to it.
So I think one of the things that we've been looking at this, I mean, this was startling. It was bothersome to us. I mean, because there have been many patients who've had anosmia. They can't smell. You struggled with that as well. So, you know, many of these flu type things can affect it, especially COVID. Definitely dealt with here, and your tinnitus in there as well. And I think that's something that, you know, people need to be thinking about. What Dr. Simeo is doing is coming up with unique ways of fixing the tinnitus. I think a lot of the tinnitus clinics that you studied on this thing were trying to just push, you know, a hearing aid, you know, option. I mean, we're fine with that. I mean, you know, we can do that, but that doesn't always handle the problem.
Right.
And so you're a person that is perfectly normal hearing. You had a little bit of hearing loss though too, didn't you? Because of that?
So when right before we did the pitch matching and everything like that, we did just a regular hearing test on me, and we knew prior to this I had normal hearing across the board, but right up in my high frequencies, it dropped off. I even retested myself just because I was like, is this right? And it was really upsetting to me first to go from, you know, normal hearing to having hearing loss, and then to also have the ringing on top of it.
Right.
So yeah, that was upsetting.
I mean, I think one of the things that, you know, we were super, I mean, on a weird way, we were excited to be able to you know, to touch someone and go, holy cow, could we make a difference? You know, and I think one of the things that you guys might want to consider is these are my two audiologists that are with me, and she's experienced this stuff. I mean, how many times are you going to find an audiologist that's experienced what we're dealing with? So with COVID symptoms, you can have anosmia, hearing loss, tinnitus, and other potential, issues that can happen because of that. And therefore, we have audiologists that can go through that with you, walk you through those phases. And so that's why I would really recommend that you check us out at heartulsa.com. And, you can check out her story. We'll probably put some stuff on the website a little bit about that as well. And so that you can kind of check us out. So if you like what we talked about here, leave some comments down below. We're open to see audiology patients and tinnitus patients as well, specifically. And I think you can ask for them to do that. So thank you so much for coming in.
Thank you.